Hi there, I'm Dr. Emily Graham, one of the veterinarians at Westhills Equine Vet Services. This month we're talking about all things equine lameness. So I just wanted to go over kind of what we do in a lameness exam. One of the most important things is history, so getting a thorough history from you about how long this has been going on, what leg you think it is. Is it been up and down? Has it been consistent? All that kind of stuff is really important for us to kind of get some diagnoses in our head. Once we get a good history from you, another important thing that we start with is kind of a good physical exam. So we palpate everything, we feel all the muscles, we feel the back, we feel the limbs. We're looking for heat, swelling, pain. We're looking for any range of motion issues. We're looking for any joint effusion or joint swelling. And all that is super important to kind of give us a hint of where our lameness is coming from potentially. One of the other things that we end up doing after kind of a full physical exam is we like to watch the horse go. And when we watch the horse go, we like to watch at a walk and trot on a straight line. We also like to watch on a circle, both directions. And ideally, we like to watch on a variety of surfaces. So soft surfaces, hard surfaces, all that kind of stuff. And that gives us an idea of what's going on for your horse's lameness. Once we do that, we can figure out which leg is lame, and we can grade our lameness. So when we're grading our lameness, we grade it on a 5-point scale, 0 being sound, and grade 1 being that the horse is inconsistently lame under certain circumstances. So that would be like if your horse is only lame on the circle to the right and it's only, an inconsistent head bob or something like that, only on that circle to the right, that would be a grade 1 lameness. A grade 2 lameness is when your horse is kind of consistently lame, but only in a certain circumstance. So again, to the right, your horse is lame on the right front, but to the left, your horse is sound. So that would be like a grade 2. Grade 3, your horse is lame in all circumstances, so on a straight line, on a circle to the right, on a circle to the left, and that would be a grade 3 lameness. Grade 4 lameness, your horse is lame at a walk, and grade 5 lameness, your horse is pretty much non-weight bearing lame. After we have a look at the horse, one of the things that we like to do to help with our diagnostics is flexion tests. So when we do flexion tests, what we do is we hold the limb up in a certain position for about a minute or so. And what we're doing is we're kind of stressing the joint and the tissues around the joint. And then we let the horse go and trot it in a straight line, and we watch if there's any difference from our baseline lameness to what our flexion tests are doing. And if there's a difference in the lameness, if we're looking at a bigger head bob, or the horse doesn't want to go forward, or things like that, then we can say that our flexion tests were positive, and potentially that area or that joint may have an issue going forward. So that can help us determine where our lameness is coming from. So now that we've gotten our history, we've kind of done our physical and palpation exam, we've watched the horse go, we've done some flexion tests, we may end up needing some more diagnostics to know exactly what's going on. We may end up doing some nerve blocks, we may end up doing some ultrasounds, or we may end up doing some x-rays. So I just wanted to talk to you quick about some common findings that maybe we see. So in this x-ray here, we have a horse that flexed very positive on her knee. So when we x-rayed her knee after, we actually found some pretty significant knee or carpal arthritis. And if you want to take a look at this x-ray here, you can see the nice smooth bone here, you can see the nice smooth bone down here, and here are our joints, our knee joints here, and right here. So what you do notice is that there are kind of these large spurs on the front, and you can even see a little chippy right there as well, and then again a large spur on the front of this bone as well. Back here there is also a little chip here, and then also a large spur here. So this is actually a horse with pretty significant carpal or knee arthritis, and we found this by on our lameness exam and by watching the horse go and by flexing the horse. I'll show you a different image here. So this is the same horse. And again, you see the smooth bone here, you see the nice smooth bone here. So these bones should also be smooth. And you can see here, this is some significant knee arthritis. You can actually also see the soft tissue swelling on this x-ray from the knee arthritis causing that soft tissue swelling as well. Another common lameness that we see is something called caudal heel pain or caudal heel syndrome. A lot of people know it to be navicular syndrome. Caudal heel pain or caudal heel syndrome kind of encompasses the whole heel area, so there can be involvement with the navicular bone, there can be involvement with the soft tissues back there, there can be involvement with the navicular bursa back there. So lots of components of caudal heel pain. I'll show you an x-ray here of a horse with caudal heel pain that has some significant navicular changes. All right, so this is just looking at a horse with some significant navicular changes, and he was diagnosed with caudal heel pain. So just so you have some landmarks here, this is our hoof wall here. The horse is obviously wearing a shoe. We have our P3, which is our coffin bone, our navicular bone here, P2, which is our short pastern, P1, which is our long pastern. We have our pastern joint here, our coffin joint here, and then our navicular bursa sits back here. So some significant changes on this horse lie in the navicular bone here, and you can see this here. This is quite a large bone spur on the back of the navicular bone. Usually the navicular bone is a lot more square, so kind of ends in this region here, but we actually have a large spur here, and the problem is that there is a deep digital flexor tendon that runs all the way back along here and hooks back in here. So when we have this large spur, we can have a lot of issues with some soft tissues in that area being rubbed. We can also have some inflammation in our navicular bursa back here, and just in general, some difficulties with that heel pain. So this horse has a large spur on the back of his navicular bone. So that's kind of what a lameness exam entails and all the diagnostics along with it. So thanks for listening in, and if you have any questions, let us know and we'd be happy to answer.